Marking 30 years of South Africa's Bill of Rights, the Centre for Community Impact, or CCI, has rolled out a nationwide program to combat HIV, TB, STIs, and gender-based violence among sex workers. The initiative, covering 8 provinces and 18 districts, aims to tackle the high rates of infection, stigma, and violence faced by this vulnerable group. This is supported by the Global Fund to Fight AIDS, Tuberculosis and Malaria. And to speak to us about this, we're joined by Tonderayi Macheka, who is Senior Program Manager at the Centre for Community Impact. Thank you so much for joining us, Tonderayi. Good morning.
Good morning, Asada, and thank you very much for having me on the show.
Our pleasure. Thanks for making time for us as well. So, South Africa is marking 30 years of its Bill of Rights. Why was it important that a part of the focus becomes on sex workers and to launch the HIV, TB, STI, and GBV prevention program for this group?
So, Asada, thank you very much for that. I think 3 decades of the Bill of Rights in South Africa is obviously a meaningful moment for us as a country, and it becomes the right time to really reflect on the need to focus on sex workers as one of the world's oldest profession in the world, to reflect on their lived experiences, and also remind everyone that everyone has got the right to dignity, equality, and access to healthcare. So we felt that launching the program during Human Rights Month is critical in reinforcing the message that sex workers are indeed part of our society, and their health and safety matter too. It's about sex workers realizing their constitutional right, because we feel it is time, and there's been quite a lot of interventions around that. So all this is happening at a time at which the Global Fund itself has started implementing a new grant Cycle 7, which is literally signaling renewed efforts to continue to support efforts towards improving, promoting, protecting, and also advancing all-inclusive public health responses for the most at risk, vulnerable, and marginalized sex workers in South Africa. Thank you.
It's 8 provinces and 18 districts that are going to be covered in the rolling out of this program. The country does have 9 provinces, though. Is there any reason why this was particularly the choice? And what went into discussing or choosing which of these areas would be targeted?
So in terms of identifying the key areas to implement the program, we use the population size estimates to determine where the interventions need to go to. So in choosing the 8 out of the 9 provinces, obviously it was based on the population size estimate for the sex workers. The only excluded province here is the province of Mpumalanga, but also citing that there's been a lot of investment in terms of service provision for sex workers within that province, which was being implemented during the USAID era. So Global Fund has maintained the 16 districts that it has been supporting over the years, and also adopted 2 new districts that are big, which were being supported by USAID, but unfortunately could not be continued to be supported because of the USAID work step order. So yes, we do look at the population size estimates. We do look at the needs of sex workers, risks. We use a lot of data. There's quite a lot of data that is being used on studies that has been conducted in South Africa. So that's what has driven the program to go to those specific areas. Critical is to retain and maintain the interventions, leverage on the work that has been done to make sure that the investments that have been made in the long run really lead to the expected health outcomes that are targeted at the sex workers.
From that data, what are the barriers that come up that sex workers face when trying to access healthcare services? They do still remain one of the most vulnerable groups to HIV infection and violence in sub-Saharan Africa.
Indeed, in terms of health, sex workers are supposed to receive comprehensive health services through mainstream public health facilities, be it fixed or mobile facilities because they are a highly vulnerable population. But there still exist barriers from studies. There's quite a lot of barriers that have been identified which limit their access to much needed prevention, treatment, care, and support services. There's a lot of stigma and discrimination, which is one of the barriers. And this has just been confirmed by the most recent stigma index study that is conducted by South Africa, led by the people living with health sector through SANAC, which has showed that there's a lot of stigma and discrimination. There's also quite a number of negative attitudes and value judgment by healthcare service providers that are lacking sensitization in terms of serving these specific key populations. For instance, you find in a facility, sex workers, when they collect condoms, they would like to collect maybe 10 or 20 because those are the tools for their trade. But obviously, once it's out of the norm, for unsensitized service providers. So those are some of the challenges that we're confronted with. There's also been a lot of violence, harassment, and fear of arrest because sex work is still criminalized in South Africa. And all these discourage them from seeking healthcare because they're afraid at any given point in time they may be running from law enforcement agents. So our sex workers are harassed every day, and it creates a challenge in terms of them accessing services. But also there are broader economic vulnerabilities and other legal, financial, and social challenges that really underpin this industry, and they lead to really limited access to healthcare service provision. So there's quite a lot of evidence out there in terms of these barriers to accessing health services for sex workers. Thank you.
And given that stigma, then, and the negative sentiment that sex workers deal with when trying to access the healthcare services that are mainstream, what are the challenges then that does that bring forward in terms of them seeking alternative areas or places to get the assistance that they might not be getting from the mainstream side that might end up being illegal? And how is that one tackled?
Yes, of course, there's alternative ways of seeking healthcare services for sex workers, and it definitely leads to them not necessarily accessing them through mainstream public healthcare services, and it creates problems in terms of, adherence. I think it leads to also high mortality, and I think at an opportune time of what some of the interventions that are in play now is the program that we've just talked about, which CCI is implementing across the 18 districts funded by the Global Fund, where a sex work program has been funded um, largely as a comprehensive package of care through an outreach-based peer-led intervention, where we are now going out to the communities, identifying peer navigators, which are largely coming from the sex work sector, training them, and then equipping them with the necessary tools to provide services to sex workers. They know where the sex workers are, and they can easily access the sex workers at any given point in time. So the package of interventions that the Global Fund is funding for South Africa, which is being implemented or led by CCI and implemented by a number of sub-recipients across the 18 districts, really come in handy, and they provide a lot of interventions. For instance, we provide biomedical interventions, which are mainly HIV, TB, and STI screening services. Um, in the sex work hotspots. So, for instance, we extend our services to brothels. We extend our services to all other hotspots where sex workers are, and we provide such HIV, TB, and STI screening. Once we identify that a sex worker is HIV positive, we then link them and refer them to the nearest health facility for treatment initiation and follow-ups.
Right.
And this is coupled with psychosocial support that we also provide. But over and above that, there's quite a lot of other interventions, including behavioral interventions that are provided to sex workers, and other structural interventions where we are now looking at managing issues of gender-based violence and screening across sex workers as well. Thank you.
All right. Tonderayi, we're going to leave it there. Thank you so much for talking to us this morning.
Thank you very much, Asanda. Have a good day. Thank you. Bye.
You too. Tonderayi Macheka rather, is a senior program manager at the Center for Community Impact, talking about a nationwide program to tackle HIV, also with the goal of ending HIV as a public health threat by 2030, but specifically targeting sex workers and their access to healthcare services.
Africa Update.